All right, so the next category is going to be healthcare. And we have seen that there is a direct attack here on Texas from the federal government, trying to get people to become more reliant upon the federal government. So the question is, and we'll start with you, Brad. The question is, federal government wants to expand Medicaid in Texas. How would you expand free market solutions into healthcare and limit federal government overreach in the state of Texas?
It's a great question. So, healthcare has been something that has been on the debate stage and made super partisan since, I don't know, I was in college, okay? So, one thing is in Texas is we gotta make sure that we protect ourselves and allow a free market within Texas. But nationally, that's not my job. I'm gonna be your congressman. I'm gonna make sure we go ahead and allow competition to go across state lines. We have to make sure we're protecting pre-existing conditions. Allow for new methods and therapies. As if you notice, you're not allowed to try anything the government tells you you're not allowed to try. Okay, so that's a problem. So we're going to limit that. We're going to allow the private sector to get involved and to be able to make new treatments. I mean, there's new therapies out there every single day, but we have to get this rid of one size fits all. We're not going to forsake people who bought into the system. We're not going to forsake people who can't take care of themselves and need help. That's not who we are in North Texas. But what we are is innovators, and I trust that the private market and the private sector will get it done. I trust we'll take care of it, and we'll have innovation. We'll have new methods. So I trust that we'll be able to do that. Thank you.
So, as a common theme with all of us up here is we want the government as far away from us as is humanly possible. As a veteran, the VA hospitals are absolutely free to me. I could go to any time, and I refuse to go. You've heard the horror stories of what happens in the VA. The federal government wants to make that the same system across the entire country. I can't imagine anything worse than having our entire medical system operate just like the VA does. So what we need to do is make the medical system more of a free market economy. When you go to a doctor, you have no idea how many surgeries he's done, how much he's charging you, how many people he's killed doing those surgeries. It's completely black box. We need to open it up so you can see how your hospitals are rated, how the surgeons are rated, how many times they've done their surgery, and how much it costs, so that you can be a shopper of your medical care. You can go out and find the best doctor for the best price, just like you can with any other product in the United States.
There's not a more complicated issue, I don't think, to deal with than healthcare. We've been talking about this for decades, right? It's very complicated. I can't handle this in 60 seconds. It's my most detailed policy on my website. There's 15 points on how we're going to address this. I just want to talk about one right now. About 600,000 people every year go bankrupt because of medical bills. I think that's bad. And so we should never allow that to happen. I mean, the government can easily cover those costs. It would be minuscule on the budget that we currently have. But one thing I want to just clarify is the political implications of a nationwide Medicare, Medicaid, whatever we want to do, the single payer system. California, their politicians always said that they want single payer, but they never pass it in their state. But then on the national stage, they want to pass it. The reason they're doing that is because they have disproportionate power in DC. If all their money goes to DC, they can reallocate it so they have great health care and they take our resources for their health care. It will be terrible for Texas. We should be viciously opposed to this.
Thank you.
Thank you. Health is an individual responsibility. In America, we sort of get sick, let's find a cure. Or how about the prevention part of it? How about getting in front of some of these things? Because some of the things may be lifestyle that give us this health situation. We have, in America, our doctors are the most paid in the world. It's not because they are so sophisticated in what they do. It's because of what? Insurance companies, and then because of, the money that if you go up, you get paid. So what we need to do is emphasize individuals taking responsibility for their health.
Yes.
It's very important. No amount of sophistication is going to give you the life that if you don't want to have it. And so our health care is because of that. Have you ever looked at your medical bill?
Oh, yeah.
I mean, for just your headache, how many people are going to see you? And they're going to bill you for that. We have to make sure that that doesn't happen. Thank you.
I have to ask you a fundamental question, though. And I see what's happening
with how our government is changing how people think and what they believe. There are people that believe that health, and you might be one of them, that health care is a fundamental right as an American, that the government should take care of all of our health problems. And that is kind of what we're fighting too. As an employer, I had a lot of employees. I was able to offer full health care to my corporate staff and some of the management team. Since 2013 to today, those premiums are up 105%. It's unbelievable. Obamacare came on the scene and it said, we're going to do a great thing. We're going to have fewer uninsured Americans. Well, they accomplished the goal. They said, give me the number and we'll hit it. Well, they got the number and they accomplished it by putting more people, 34% more people, in fact, on Medicaid. And then they subsidized the premium, so it's just another entitlement program.
Time. Thank you.
You brought up Obamacare, and I want to get a quick show of hands. Who in here's insurance policy rates went up because of Obamacare? Everybody. A stark example of what happens when the government is interfering with healthcare. Our healthcare is broken, and it seems like year by year, the federal government is more involved in our healthcare system, and therefore, every year, year by year, it seems like our healthcare system is going down. So we've got to have people in Washington that have the guts to fight against things like Obamacare and pull the federal government out of the health insurance business as much as possible.